Today, we're going to be talking about the return of the Jedi, but probably not the Jedi you're thinking of. If I showed you this object, and I asked you to tell me what the name is, you might have absolutely no idea. You might say it's an ice cream maker, or if you're steeped in the world of the Force and the Empire, you probably would say, the things that we know and the things that are familiar to us are largely shaped by our cultural worldviews. And if I showed you something like this, if you're not from West Africa, or if you're not someone who is well-versed in the instruments of world cultures, you probably would not know what the answer is. Does that mean that you are less intelligent than someone else? Or does it just mean that because of where you're from, there are certain things that you know and certain things that you don't? As a neuropsychologist, we do a wide range of activities when we deal with patients. Some of them are pencil tests. Sometimes we do things like show people items and ask them what they're called. And it's very important for us to know people's cultural backgrounds so that we're able to determine whether or not the items that we're displaying and having people participate in are culturally appropriate. Neuropsych tests are not trivia games or Jeopardy. It's not supposed to just find out all the things that you know. We're trying to find out how your brain works. And so if there are things that you don't do well at or you find very challenging simply because you've never been exposed to them before, the things that I might be looking for in those brain behavior relationships might not be revealed by what you know and what you don't. So before neuropsychologists do tests, we do what's called a clinical interview. During that interview, we ask a whole lot of questions about your life, your background, your education, where you're from, your acculturation, your nationality, all of those things, because those things are important in order to figure out what tests are applicable to your situation and what will best reveal information about your brain and behavior that can be used to give you an accurate diagnosis. And being able to understand your culture, your background, is an integral part of that. I know a lot of people don't think that it's important, but it really is. And that's the Jedi that we're going to be talking about today. Justice, equity, diversity, and inclusion. I know a lot of people think that those are just buzzwords, but they really are essential to being able to give people the best healthcare possible. Let's shift a little bit away from culture and talk about another important component of diversity, which is language. Now, that is an integral part of being able to give an accurate neuropsychological assessment. It's important for me to know, not only do you speak the language that I speak, and I most fluently speak English, but it's also important to know whether or not you are also fluent in English. Is it your first language? Is it your best language? Is it the language that you think in? The reason why is because, again, neuropsych is supposed to be looking at brain behavior relationships. It's not an English test. And so if I'm giving you questions and asking you to do things and you're not able to perform them adequately and it's due to a language barrier, then I'm not really giving you a test of whatever it is that area of assessment is supposed to be evaluating. It's actually more of a language understanding and comprehension test. And that's not really helping me to help you. And that doesn't just go for spoken languages. It also is applicable when we're talking about signed languages. What if you're deaf? Do you use ASL or BASL or SEE or some other form of communication? This is not just a diversity issue, but it's also an equity and justice issue, because according to the ADA, we have to make sure that as healthcare providers, we're giving you the best opportunity to have equitable healthcare and making sure as a matter of law that all people, regardless of ability level, are being able to have adequate access to the different kinds of healthcare that we provide. Let's step away from neuropsychology for a second and let's talk about justice, equity, diversity, and inclusion in other forms of healthcare. Let's say you are going to a dietitian or a nutritionist because you need help trying to rearrange your diet because you have a surgery upcoming, or maybe you've got a diagnosis that means that you need to change everything that you do with reference to how you eat. It's important for that dietitian to have a cultural understanding of the foods and the preparation techniques that are germane to you. They aren't supposed to be just giving you information based on what they like to eat. They have to help you to be able to incorporate the dietary recommendations into your lifestyle. And so that means having an adequate working knowledge of your culture. If you've ever been admitted to the hospital, you've probably had one of those little ET looking things on your finger to make it glow. That thing is called a pulse oximeter. It's measuring the oxygen saturation levels in your circulatory system. And the people who are attending to you are supposed to be able to look at those readings to monitor whether or not you have adequate oxygen. But did you know that pulse oximeters can be more or less effective if you have lighter or darker skin? Actually, not every healthcare professional knows this. And that is a big deal because if you're monitoring people's oxygen levels in the hospital, it can be a matter of life or death. People who have darker skin might not be getting adequate readings, and those people with lighter skin are getting adequate readings because the pulse oximeters were tested and manufactured based on lighter skin tones. That tells us that not only is there an issue with making sure that healthcare professionals are adequately educated on these differences, but also it kind of makes us question, well, why is there this difference in the first place? Why didn't the research and development of this instrument take into account the fact that there are different skin tones in this world? Is there a reason why they didn't think of that people with darker skin might not get the same types of readings as people with lighter skin? It didn't cross the minds of those people who developed this. And when they did testing, did they not test it with enough people with a diverse color palette in their skin tones? A lot of times, unfortunately, there isn't diversity in research. There isn't diversity in clinical trials. And so instruments like this are only tested on one population. And then when it goes out into the world, it isn't generalizable to all people. And this, again, can lead to some very, very serious healthcare issues. I had a little rash on my wrist a little while ago, and I tried to use one of those apps that lets you take a picture, and it's a dermatological app that tells you what kinds of things might be going on your skin. But this particular app, again, was normed on people with much lighter skin tones. And so it wasn't as accurate as if it had been something that took into consideration all types of skin tones. It goes to the heart of even our research and development needing to be more inclusive, needing to make sure that it's taking into account a diversity of groups so that when these instruments are developed, they're developed with all types of different people in mind. And unfortunately, that's not such a rare instance. In a lot of dermatology textbooks that are used to teach medical students, the symptoms and the descriptions of different pathologies of the skin are all about what these different conditions look like on people with lighter skin. And a lot of the diagrams and pictures aren't diverse either. And so you have dermatologists who are not being educated about the diversity of the ways that these different symptoms can show up in different people. Because if the symptoms are that the skin will turn purple or red or blue, and your skin is so dark that it would never turn any of those colors, it would be very difficult for a doctor to be able to diagnose you properly because they weren't educated on what those different things would look like on your skin. Equity, diversity, and inclusion are not just applicable to things like skin color or culture, but we need to make sure that we have diversity in gender as well. For the longest time, the American Heart Association would tell people that the signs of having a heart attack were tightness in the chest and shooting pains in the left arm. And those are signs of a heart attack in men. Millions of women would be having heart attacks and they wouldn't have those classic signs, and so they wouldn't realize what was happening. And when they would go to their doctor, the doctors wouldn't even know what was going on because it didn't fit the stereotypical signs that they were taught, because those symptoms were based on how heart attacks showed up in men, not in women. Women sometimes get pressure in their abdomen or in their back, or sometimes in their throat and their jaw, and those things might not signal to someone that they're having a heart attack if they don't realize that heart attacks show up differently depending on your gender. That's why it's so important that in clinical trials and in research studies that we make sure that we're testing on a variety of different people, different cultures, different genders, different ages, so that we're able to capture all of the different ways that things might show up in a variety of people. If you are someone who is religious, you may or may not have certain things that are important to you that impact your day-to-day life. It's important for me as a neuropsychologist to know about those things, because when I make recommendations, I have to make sure that they fit into your life. Let's say I have a patient who's Jewish and I have a recommendation that she go to a treatment program. If I know that she keeps Sabbath from Friday night to Saturday night, then I would make sure to put that information in my report and recommendations so that she's not assigned to a treatment program that takes place on Saturday morning, because that's an accessibility issue. Let's say I have a Muslim patient and I have a recommendation that they should be given psychotropic medications. It will be important information for their physician to know, because maybe there's a choice between prescribing something that is an extended release medication versus something that would have to be taken several times a day. If my Muslim patient is someone who participates in Ramadan, it will be important for them to be able to get an extended release medication as opposed to something that they wouldn't be able to take during their fasting time during Ramadan. Justice, equity, diversity, and inclusion are important in all aspects of healthcare, from research and development and clinical trials, to education of our practitioners, to the actual treatment of our patients. If you have a clinician who tells you that justice, equity, diversity, and inclusion are immaterial, I need you to run faster than the Millennium Falcon trying to win the Kessel Run. I need you to run like you are in a hallway where a Skywalker has just ignited a lightsaber. I need you to run fast and far to someone who is actually culturally competent, because justice, equity, diversity, and inclusion are important for all aspects of patient care.